It's recording. Hello, everyone. Thank you for being here today. I'm really excited to talk about this topic because it isn't something that everyone talks about. I will be talking about prescription drugs and your children, meaning anything that your child interacts with, any sort of prescription drug your child interacts with. We'll kind of be talking about that today, but more specifically, how we can help them understand the process of prescription drugs and how it can further their knowledge on prescription drugs. So here, okay, so why this presentation? This is not to scare you. This is to inform you, and this is also not a parenting class. I want to reiterate that you are the best parent for your child. You know them the best. Meaning that anything that I claim here, anything that is stated here, is really just on my perspective and my approach shaped by my learning experience. It's an evidence-informed presentation and some evidence-based. So meaning I compile a lot of the information for you, I put it in this presentation, and any questions you may have, I'll do the best to answer them, but I also give all the resources and every bit of information I have learned at the end of the presentation. So you can also look at those resources too. And I also put them in our YouTube videos as well. So if you look under the under our channel name and you click the information tab about us more, then you'll be able to see what resources I put there, but also what we're about a little bit. So who am I? My name is Ruth Del Pino. I am a prevention educator. I know that a lot of people have been following the series, so if you don't know who I am by now, that's okay. I am the Mercer County Coordinator for the Mercer Council on Alcoholism and Drug Addiction. I have a Bachelor of Arts in Global Studies, Political Science, and American Studies. I am certified in TEFL, leadership skills training, and leadership. That's a little bit of a mouthful. So we're going to kind of jump into it. Now, why is this something that needs to be addressed? There are quite a few different reasons, but we're going to be touching upon a lot of those. Prescription drug use is on the rise within more mental, we have more mental health diagnoses. There are not many recent studies on prescription drug use and abuse, but I had found this study by the University of Alabama Medicine, and it is from the years 2013 to 2014. It said 19.8% of children and adolescents used at least one prescription medication, and 7.1% used acute medications. Acute meaning that they were using it for something like a very strong dose or something that needed to be used to help them get through their lives in some way. Concurrent use of prescription medication was 7.5% overall, and was highest among boys 6 to 12 years old, 12%, and among boys and girls ages 13 to 19%, 13 to 19 years old, 10% for both. So that means that when you have concurrent use, it also means that you're using something out like next to, or you have one thing and then you have another drug to hopefully that interacts with that drug as well. So that's some interesting information. That's not a lot of children, so that is something to reiterate. Using pooled 2009 to 2014 data, they found that 88.2% of concurrent users, meaning people who use more than one type of drug, of prescription medications, were at risk for a potentially major DDI, meaning drug-drug interaction. So if you have one kind of drug and another kind of drug and they sort of interact with each other, you are at risk of hurting yourself in some capacity, meaning that, for example, the other day I had to, I take an inhaler and I need the inhaler because I have asthma. And this inhaler can cause yeast infections. And I also had to take prescription medication that it was an antibiotic. So the antibiotic interacts with yeast as well. So that was something that my doctor was worried about. That's just sort of the drug-drug interactions they're talking about. The vast majority of interacting regimens involved antidepressants and were more common among adolescent girls than boys, and driven largely by greater rates of acute medications. So antidepressants, it has to be taken, and then you have something alongside it. So I also want to say that I have quite a few links here. That study in particular that I was citing is right here for you. if you have anything to talk about in terms of teen addiction and where teens kind of hide their drugs and whether or not you're looking to see if they are having substance abuse or misuse, that is a great resource to hold. The other thing is that why is also this something that needs to be addressed? Drugs are, drugs are in the household, meaning that if you or someone you in your family takes medicine, heart medicine, takes antidepressants, anti-anxiety, anything to help, blood thinners, anything to help with everyday to day life, it is in the household. So children can be around it and they are exposed to it in some capacity. And it would help for them to understand what is in the household and to know what's off limits and to sort of see the healthy ways of interacting with medications. Also, I just want to put this here: drugs are bad, just say no. That is something that I hear a lot. That is something that you have a lot of organizations like DARE say, and that's great for some capacities. And we will discuss that a little bit more later. So also, I have a study here underneath that is actually through WebMD, but they cited a study from the U.S. Public Health Service. So this was something I also looked into. That study is cited at the end of the resources. They were talking about prescription drugs and how they were on the rise for children and how children are being prescribed more things. They actually didn't find a lot of drugs or prescription medication that went up or down, besides contraceptives and ADHD medication, and some mental health diagnoses, but most doctors don't start children on those until a little bit later. Contraceptive prescriptions rose 93%, and prescriptions for ADHD drugs were up to 46%. This does not mean that doctors are overprescribing, but it does mean that that is up for the professionals to decide. But what is the concern here is that if children are interacting with medication and prescription medication, they need to know what is going on in their bodies to understand what is happening to them. And that is something that we're going to be addressing. This is also something that needs to be addressed. Continued drug misuse and abuse due to peer pressures, lack of understanding, and misinformation is something that is very real and does happen every day. Abuse leads to changing brain development. And I will sort of be talking about brain development. So I have a picture here. It talks about sort of the formation of the brain and how there are certain parts that are developed and underdeveloped. Basically, the way that it works is a lot of the time when you have brain development, it starts in the back and it starts to slowly evolve towards the front. And that means that a lot of the survival instincts and a lot of the things that children need to survive to get through day to day, they already have developed by the age of 5. And slowly over time, their brain starts to develop more and more and more. And as you see here, the blue parts are the parts that are the fully developed parts. So everything that is fully developed becomes fully developed between mid-20s, and sometimes in rare cases, you have 27 to 30 years old as the ending point for brain development. And that is something that I think should be addressed, because the prefrontal cortex is the last part to be developed for any person. And that is where most of the decision making is made, and your impulse control, meaning that if you start a substance use disorder when you are younger, it is very hard to get over it if you had started it before the age of 25, because your brain is not fully developed. And the way that it sort of interacts with your brain is that it impacts perception. And it's a skill that children need and actively should try to cultivate. And this can fracture developing neural pathways, meaning that what decisions are made, the outcome versus the input versus the output, those are all sorts of systems that we learn through trial and error and making decisions on our part. But what that also means is that when you have this sort of system, those pathways, if they are developed before the age of 25, that means that it sticks. Whatever is reinforced ends up sticking. So the reward system that the brain has due to drug addiction really does change the formation of the brain. And that is something to be addressed. Drug prescription misuse and abuse can affect judgment, inhibition, putting adolescents at a heightened risk for HIV, sexually transmitted diseases and infections, misusing other kinds of drugs, and engaging in additional risky behaviors. But these are all things that we sort of knew through time. So I sort of wanted to show a video on misuse of drugs in teens, just so we could sort of have that kind of conversation and introduce these parts here. So here it is. Give me a second.
Has become the drug problem of the 21st century.
Robert Stutman spent years as a special agent with the government's Drug Enforcement Administration. He says many teens don't realize that medicines can be as dangerous as illegal drugs.
Kids believe that because it originally came from a doctor, it is safe, and nothing could be further than the truth.
These medicines are called prescription drugs. That's because they are ordered or prescribed by a doctor or other medical expert.
If you have a drug and you're taking it, then a lot of thought has gone into the dosage and frequency with which you take it.
Dr. Abbott works for Quest Diagnostics, a company that specializes in healthcare. Quest wants teens to know that taking someone else's medicine puts you at risk for heart problems, addiction, overdose, even death.
The majority of those who died from drug overdose in this country, about 60%, died from prescription drug overdose.
Take, for example, kids who have trouble paying attention, especially in class. They have a chemical imbalance in the brain. There's medicine that can correct that and help them be able to concentrate better. But some teens who don't have that chemical imbalance mistakenly believe taking that medicine will help them do better on tests.
And there is tremendous pressure on kids who have the prescription to share it with their friends.
And as I said in the beginning of this report, another place kids find other people's medicine is right at home.
Quite often, family members that are prescribed medication leave them after having used the majority of the medication. They leave the remainder in a medicine closet, and unfortunately, that becomes the access point for teenagers to acquire prescribed medication.
They don't really realize what they're taking, but they're just taking it because they can.
These are scenes from a documentary made by a teenager. It's called Out of Reach, because that's how prescription drugs should be kept. Out of reach.
How do you start that?
I just took pills from the medicine cabinet.
Besides the health dangers, here's another reason to avoid taking medicine not prescribed for you. It's illegal. The bottom line, taking someone else's medicine can be a prescription for trouble. For Teen Kids News, I'm Emily.
Okay, so I thought that was really informative, but also kind of cute because it is a channel on YouTube. It's called Teen Kids News. And basically what it is it informs people on the dangers teens face in society. And it is a really good tool to use because it is made by teens for teens. So the peer-to-peer information is really important as well. There were a lot of points that were in there that I wanted to address, and we will address them later in the presentation. But more importantly, it's that the medications that children are prescribed are meant for them and no one else, and that is decided by a doctor. And I think that some people, in particular, people that are really lackadaisical about prescription drug use, just sort of say, "Oh, you're feeling tired, or you're feeling, you want to pay attention. Here's some of my medication I didn't take, and I have ADHD." So it's sort of it's this peer pressure for students who have ADHD to share their medication, but it's also the pressure of students in particular because they have a lot of schooling to work through. They have grades they want to keep up. They can lead to some desperate circumstances to want to escape. So also being in their day-to-day lives really does help with that process and helping them understand their own stressors. So I do, excuse me. So here, I just sort of want to see, there are people that don't really know what prescription drugs look like in some capacities. Stimulants kind of look like this, in that Stimulants are things that speed up your heart rate. There are opioids, which help with pain management, and depressants, which help slow things down in your system, such as anxiety, depression, things like that. So I also have Xanax here, and I just wanted to also reiterate that we won't be touching upon illegal street drugs because that is something for a different section, but illegal street drugs are definitely a thing, and there are people who make it seem like that is something very legitimate. So as long you can buy pill presses on Amazon for very little money, and if you have the ingredients to put them together, you can just sort of put your own stamps on this. So you have Xanax here, and then underneath you have a street Xanax. So there are different parts of that as well. And that might be the back of actually that Xanax, but street Xanaxes look very similar to this. There's also Adderall and modafinil, sorry. And they sort of look like that, but just to know sort of what the prescription drugs looks like helps understand, what is that, bag of whatever in my child's book bag, that introduces some of those things. And many US children and adolescents use prescription medications, and I do want to make that clear. Nearly 1 in 12 concurrent users of prescription medications are potentially at risk for a major DDI, meaning drug-drug interaction. But remember, that's 1 in 12. So that's not, copious amounts of people or teenagers wanting to, do drugs and are actively seeking it out, and doctors are actively seeking to prescribe medication. It's that it's 1 in 12, which is enough to be concerned, but it's not something that is plaguing the scene for a misuse of drugs. Efforts to prevent adverse drug events in children and adolescents should consider the role of interacting drug combinations, and especially in adolescent girls, because adolescent girls going through puberty is a very vital time for them to, be biologically set for the rest of their lives. And once again, this isn't discussing the illegal or the illicit street drugs that can be found. It's more unlikely for children to have access to illicit drugs because just of the nature of it. They may have older siblings, or they may have older people in their lives that do have access to those things, but the front line of their interactions and what they see first is the prescription drugs and medication that are surrounding them in their household and in their day-to-day lives. But especially when it comes to drugs, it's most likely expired pill bottles from friends or family, or medication they were prescribed and no longer need to ingest or use. So that's also cause for concern. I'm talking about now the prescription drugs and the body and the brain. So there's a lot to it. I have a lot of resources cited here because I wanted to make sure that I was doing this correctly, but also if you have any questions on any of these things, because stimulants, opioids, and depressants, which are the 3 types of prescription drugs, they are that are more readily available. They interact with the body differently, and not many people know the differences between stimulants, opioids, and depressants. So I'm going to try to do my due justice here just for summarizing purposes. Stimulants are drugs basically meant to raise your heart rate. They increase attention and energy for people who want to focus. Or who need to focus rather, sorry. So this basically is that your brain has, if you take a stimulant, your brain is absent with a particular or hormone or chemical, a chemical that helps your brain understand how to interact with day-to-day life. So a lot of people with ADHD and ADD tend to take Adderall or Ritalin to sort of help them focus. And this is a stimulant that makes sure that their brain is focused and laser wired on something so that they can get through day-to-day life and it's not as difficult for them. Opioids are drugs usually meant for intense pain management. This is where you find oxycodone, fentanyl, Vicodin, things like that. And opioids are chemically related and interact with opioid receptors in your brain and on nerve cells. So that's something to address as well, because they interact with your brain so readily, and they basically touch the points that are for your nerves, meaning that it sort of gives you this, like, imagine having an intense pain and then having an intense relief afterwards, or as much of it as you can, considering you're in intense pain. That's a feeling that's really hard to not get away from. That's a feeling that's really hard to let go of, right? So when you have these sorts of people who are interacting with opioids, just making sure that they are taking it through a doctor, that they are taking it as a doctor has prescribed, and also while you're on opioids, to always have Narcan just in case of any sort of accidental overdoses that may happen during that time. I will also have resources for Narcan at the end of the presentation if you are worried about opioid overdose or use or misuse. So next we have is depressants, which are medications that can include tranquilizers, sedatives, anti-anxiety. Basically, depressants are things that kind of slow you down in terms of your brain is sort of super wired to take on the world, to sort of interact with the world in a different way. So when you have a lot of that, it's really hard to like see that that's a problem or that's something that needs to be addressed. So when you have things like Valium and hydroxyzine, they can be used for anxiety and mood disorders, but if taken too much, then it leads to a high feeling, much like either opioids or stimulants would do. And it sort of messes with your brain chemistry, and that's not something you really want. So this is also something that I think not a lot of people sort of bring into the conversation, is that the age of the child also indicates the interaction of the drug inside a child's system, meaning that if they are 5 and taking opioids, that's a much different system than if you are 20 and taking opioids, or if you are 7 and taking stimulants and 21 and taking stimulants. And obviously, it would be irresponsible to give a child who was 5 opioids in any capacity unless a doctor says so. But these are the sorts of things that need to be addressed, right? That the age and the development of the child and their place in puberty and their development of their brain and their body, all of that is considered when doctors are prescribing medication. And that is also something that I think needs to be added to the discourse more, saying that, oh, is that too little for my child or too much for my child? Most of the time, and your doctor does the best they can to understand how the body interacts with the chemical based on the age, development, weight, height, all of that. Also, if you have any questions on prescription drugs and the body and the brain, this is a great resource, the FDA.gov files. This is not extensive necessarily, but they do look at quite a different few studies, and they cite them in their responses as well. All of that stuff. So you're sort of, if you ask questions like, what happens if my child has a developmental disorder? How does prescription medication interact with that? Have they started using other medication? How can I help with co-current use and things like that? So all of that stuff is answered in this particular questions PDF. It's not extensive, but it is something that talks about medicine in the home, and it does help. They also give other resources about dietary supplements and things of that like. So I find that really interesting, but also, it answers questions that may seem basic, but can be better off if they are addressed and answered. So I think that the other video alluded to peer pressure in its own rights, where they were talking about peer pressure and children who have ADHD feeling the pressure to share with their fellow students. So we're sort of going to touch base on that and sort of tap into that feeling. So how does this relate to peer pressure? One, boredom. Some people are just bored, especially during quarantine and especially during the time that we have during COVID. People can be bored, and this may be the suggestion from friends and peers to liven up social gatherings. misinformation from friends, so when you have the misinformation from friends, they may give off information that they have learned through older people or TV or social media. So those are all the sorts of things that need to be considered as well. And I haven't even touched on social media here, and that's a whole different ballgame. If you are more concerned about social media, myself and Amy Argirio, who is also part of the Mercer Council, did a presentation on subtle advertising, and we really did touch upon social media and its interaction with peer pressure. So if you are interested in that, you can refer to that YouTube video later. So we also talk about self-confidence. Do your children have the confidence to say no? Do they know why they're saying no? These are the sorts of things that need to be addressed as well. If children do not have the background and know how to say no, they don't have the toolkit not to give into peer pressure. Confidence and inner wealth are a huge and fundamental part of development and growing up and becoming a well-adjusted person. If children are given access to information and know what medicine does to their bodies and other people, it can really help them coming up with their own answers and their own reasoning and really believing why they would say no. Another thing is peer pressure can be environment. Are substance use disorders in the home or with peers they are around? Do their friends maybe have some sort of prescription use addiction, or take prescription drugs that are prescribed to them, but they abuse them in some way? Is it something that happens in the home where there is someone who takes more than they're supposed to of a particular medication, takes too many, like takes 3 Vicodin instead of 1, things like that? So are they seeing and witnessing and feeling a lot of those substance use disorder ramifications? Is that something that they're a part of that also plays a role into whether or not they say yes to peer pressure? If you are worried about substance use disorders and the environment in which children are in while substance use disorders are happening, we were actually, myself, and Brian Biddings, who is the patient navigator at the Mercer Council, will be talking about a presentation next week, February 20, excuse me for a second, sorry, March 4th, my apologies, March 4th, and we'll be talking about substance use disorders and talking to children about them, while you also may have suffered from or had or are going through a substance use disorder yourself. So it is an interesting dynamic and something that I think is really worthwhile. I also want to say that ADHD is a common neurodevelopmental disorder, and we really see that ADHD plays a huge role in peer pressure because children really want to focus. This really happens among honors children who are really struggling, trying to keep up their grades or feel a pressure to keep up their grades. And they asked other students who have ADHD, who have that medication, to share. And I do have a study here that talks about ADHD and overall, just in general, about ADHD, in case you were wanting to understand ADHD more, because it is something that a lot of people talk about when it comes to prescription medication for children. Also, ADHD affects about 11% of school-age children. That means that 11% of children have the access to the medication. That doesn't mean 11% take that medication, just to let you know. So it may be something that requires medicine, and a doctor and guardians can come up with that conclusion on their own, but that is something to keep in mind. Also, the word overdose and what it actually means, what's common knowledge and what should be common knowledge, meaning that a lot of people think when you think of overdose, you're thinking of someone who who took 5,000, or like a bottle of oxycodone or Valium and decided to overdose on it. What a lot of people don't realize, and what a lot of people don't necessarily understand, is that when you are overdosing, that means that if your doctor prescribes you to have 2 pills every 6 hours and you take 3 pills every 5 hours, that's an overdose because it goes over the dose that is necessary for your body to function and to interact with that medication. So that is also something that can heavily relate to peer pressure. So is all prescription drug use bad for children? Simple answer, of course not. Complicated answer, it's complicated. So there are obvious concern for your child abusing and misusing prescription medication. It is more common than we know, but it happens a lot less than we think. It's not something that's plaguing the United States in the same way other drug use and vices are being plagued in the United States, but it is something to look out for. There are so many people who take medication and take it well. Just to reiterate to your children that, if your doctor says this is what it is, then that's what it is, so that's just sort of the conversation that should be had, right? So taking prescriptions is not always bad. And these are the kinds of questions that a lot of people could be asking, right? Do they need the medicine? Are they old enough to know what it does to their body? Even if it's, a 3-4-year-old just explaining like, this will make you feel better. When they're older, saying, oh, if you have the sniffles, it'll help, especially if you're prescribed Claritin, it will help you get rid of your runny nose, things like that. Does it make them feel normal? Does it make them feel better and, able to achieve what they want to and what they should be doing at their age, at their developmental capacity? So those are the kinds of questions that a lot of people could be asking when they're talking about prescription drug use and defining whether or not it's bad for their children. I do have a huge list. There's more than 11, but there are most commonly prescribed drugs for children. And most of them include amoxicillin and ibuprofen. I can read off the list very quickly. Amoxicillin, which is for infection and antibiotics. I guess I can't read off the list. Clavulanic acid is an antibiotic. Albuterol, which is asthma. I take albuterol. I've taken albuterol my whole life. Cetirizine, which is also an antibiotic, and there are for infection, asthma, eczema, pain, sinus infection, asthma, allergies, corticosteroids, reducing inflammation, and antifungal medication. So these are all things that are needed for children to function and feel normal, but these are most commonly prescribed drugs for children, which means that they're not going to necessarily have access to the things that we think would hurt them, such as opioids, depressants, and stimulants. And it's very possible they will have them. But it also means that if it's possible for them to have that, but these are the most commonly prescribed drugs for children, then that's also something that we can, have a conversation about, right? So I also want to reiterate that drugs are bad, just say no. It's definitely something that's been said a lot. And that doesn't mean that we won't be discussing this later. And I just have some thoughts about this that I will be discussing at later in the presentation. So just keep that in mind as we go through. So I have a video on prescription use, and this video really does help teach kids about safety and all of that stuff. So we're going to go from there. Okay.
Kids grow up fast. As they do, we teach them as much as we can about safety. Hi, I'm Benjamin Ortiz. I'm a dad and a pediatrician at FDA. One of the things kids will eventually need to know is how to use medicine safely. But that doesn't mean they're ready to take medicine on their own. Don't forget that all kids, regardless of age, should only use medicine under adult supervision. But when your kids are ready for this lesson, start by teaching them how to read medicine labels. For prescription medicines, help your child understand it's important to use the medicine exactly as the doctor directed, like how much to take and when to take it. For example, some medicines must be taken with food. Others are taken at bedtime. For over-the-counter medicine, read the drug facts label together and explain the information that helps you choose the right medicine and use it safely. Be sure to point out the ingredients and explain that taking more than one medicine at a time can be very dangerous, because two different medicines may contain some of the same ingredients. If taken together, the medicines might not work or could even cause an overdose. For liquid medicines, show your preteen how to measure the correct dose by using the measuring tool that came with the medicine. This tool may be a special cup, spoon, or oral syringe. Explain that other tools that are not meant for medicine, like spoons for cooking and eating, could give a dose that is too high or too low. For more tips on teaching older kids about medicine safety, visit fda.gov/medsinmyhome.
Okay, so that is definitely something that I think is short and sweet and to the point. It just reiterates prescription drug use and how to teach your children through it. So I think it's very useful. And a lot of people kind of feel helpless when they're talking about prescription drug use and prescription misuse. And we're sort of saying, like, out of all these things that are happening, this is kind of scary to think about, right? But what can I do? Explaining the nuances of taking prescription drugs is a huge part of it. And I think that giving the children vocabulary to know what they are feeling and interacting with may be very helpful to them. So like I explained before, children may not be given the language to understand what prescription medication can do to them, or knowing the types of drugs that that can interact with their bodies. It's also realizing that we can separate prescription medication and drugs. So I sort of wanted to address that statement before, saying just say no to drugs. Drugs in general is not a bad word. The connotation for it doesn't mean that drugs are bad. It's that drugs come in various forms and interacts with our bodies differently. So that if we have the vocabulary to understand what is good, what is a good drug, what is a bad drug, what can be a good drug, and what can be a bad drug, are all parts of those conversations to have when you're giving the vocabulary for them to know what they're feeling and interacting with. Some of the words that you can use are medicine, overdose addiction, substance use disorder, and that's just some given things. Here I have a study cited actually on genes and addiction. So if you do have substance use disorder that runs in your family, if they had an environment where someone had a substance use disorder, or they had witnessed a substance use disorder, having those kinds of conversations with your children are extremely important for them to know. And there obviously is some discrepancy and some soft evidence that implies that addiction lies in genes, but that doesn't necessarily mean that learned behavior and environment aren't a huge part of addiction or substance use disorders as well. Putting your medications in an appropriate area, closed cupboards, lockbox, high places where children cannot reach. These are all parts of having a healthy, safe home where children can't reach things that aren't good for them. Modeling behavior such as taking your medicine on time, taking the amount the doctor said, maybe even showing them or taking medicine in front of them a couple of times to explain how it helps you may be helpful to them, or while they're taking their medication, explaining how it will help them while they're taking it. Daily supplements are definitely a part of that too. If you're saying take the vitamin D because it'll help your bones stay big and strong, those are the kinds of model behaviors that really do help children understand what is good for their bodies and what isn't. Drug prescription drop-off stations. So I have here a whole list of drop-off stations where you can take your medicines that are expired, that are no longer of use to you. They have one in every county in New Jersey. And you can call all the police stations, and these are all the drop-off areas. So this is in every county, meaning that you can just find one, drive to it, and that's it, and drop off your prescription medication you no longer use or is expired, so that no one in your home can use it or abuse it. Making sure you are safe when you're taking prescription drug medication. That's also important. So that's why they have the drug drop-off stations. Also, if you have anything expired in your home, it's doing more harm than it is good, regardless if you're going to use it, because one, it's expired and it shouldn't be taken, but two, if it is something that is expired, that means that children are more likely to interact with it, find it, use it in some capacity. Also, going with your child to these drop-off stations at least once may be helpful for them to know what to do and witness model behavior. Meaning that if they see that you're being responsible about, dropping off prescription medication that's no longer good for you, or throwing out prescription medication that's no longer good for you and giving it to someone else, that's fine. And that is very helpful. Also, if you're unable to drop off your own prescription medication, you could find a friend or anyone from a nonprofit, including the Mercer Council, who said they can drop it off for you. I have dropped off medicine for several people who were passing by, and they came to the council, they dropped it off, we picked it up, and then we dropped it off as well. So, but doing it yourself really is self-gratifying, because you get to see, how you are making the world a better place by just doing the things that are good and are expected and model behavior. So I always end my presentations with a quote. And this one is by Dr. Seuss, and it says, "A person's a person no matter how small." And I did want to say this to say that I meant to say that children are going to consider prescription drugs at some point. It is something to realize that children are people. They have their own feelings and questions about what they want to put in their bodies, and giving them the resources to know the difference may make their lives easier to understand what's happening to them and their own bodies. They also may need something to take medicine-wise when they are older and of age where they can make those own decisions. It is something that means even though we want to help them, knowing what is best for your child also requires knowing the right information. While in charge of a child, they are still a person with growing opinions, and considering how their body is and how the medicine would interact with their body is a great concern that we should all make sure that we have. So thank you for the presentation today. Once again, I have the resources listed. So if you are looking for those, I definitely have those. So thank you so much. I appreciate your time and your efforts here. And I am so glad to be able to do this every week. So have a wonderful rest of the week, and thank you.